Hello. This video is entitled Dr. Jekyll and Mr. Hyde in Psycholand. It's about a journey I had from writing a letter to the editor of the Washington Post that wound up turning into a book on the history of psychiatry. Now, this is part one. There'll be a part two and a part three. I'm recording them all at once, so all the links will be in the description. So this all started when I read an article called Shock Value by Shirley Wang, an article about electroconvulsive therapy, they call it ECT for short, used to treat depression. This was published in the Washington Post Health section in July 2007, link in the description. Now, this article stuck out to me as incomplete, troubling, and dangerous. While admitting using ECT, which is simply using electric shock to treat depression, is a controversial procedure, at the same time, this article is promoting the casual use of electric shock on human beings. Ms. Wang, a degreed clinical psychologist who was completing an internship at Western Psychiatric Institute and Clinic at the University of Pittsburgh, essentially sang the praises of electroshock treatments, avoiding some of the, at least to me, obvious and very serious questions. For instance, she acknowledged in her article that memory loss was associated with electric shock treatments, which I found alarming, as memory loss is always associated with negative health issues. However, not in this case, for some reason. ECT, or electric convulsive therapy, is given to a patient by producing a grand mal seizure in the depressed person. This is done by administering sufficient electric voltage to the head, causing a grand mal seizure. A seizure which, like any seizure, is normally considered dangerous, even a life-threatening event, except for some reason in the case of ECT. The individual shocked is also given a sedative that completely relaxes the skeletal muscles to make those muscles non-responsive to normal reflexive actions. This is to prevent the involuntarily convulsing body from breaking its own bones, something that had accompanied the use of ECT in its early days of being administered. Memory loss in people, in any context, is a serious matter and suggests some kind of brain damage. But Ms. Wang indicated that the memory loss is an incidental consequence of this therapy. Why? Ms. Wang reasoned that since some people she talked to claimed their depression was improved, some even said eliminated, by the electric shock, that this side effect of memory loss was acceptable. Frying a few brain cells will certainly change behavior in any animal with a brain, especially a highly functioning one that human beings have. I mean, this is nothing new. Yet, Ms. Wang did not acknowledge damage, only memory loss, while at the same time not making a clear statement that the high voltage electric currents administered to the head caused the brain damage, resulting in the memory loss. If not the damage of brain cells, what then is the cause of the memory loss proceeding high voltage electrical current directly to the brain? If you lose or damage brain cells, you lose whatever information is in those brain cells from your past. And this would be perceived in consciousness as memory loss. Neither Ms. Wang nor the psychiatric communities even attempt an innocuous explanation for the memory loss. Not even a valid innocuous explanation for the memory loss, like the memory loss is temporary. And this seems very important to provide, particularly if you want to claim that ECT is a safe procedure. But brain damage can be the only explanation for the memory loss. Furthermore, does this therapy impair the person from remembering new data subsequent to the electric shock treatments? It's a good question. Ms. Wang doesn't venture there, nor does ECT research venture into any of these areas. Why not? It's a good question. Another question about why the medical community would support ECT involves the profit motive. Is ECT a highly profitable treatment? Is electricity cheap? Also, are psychiatric patients of ECT more vulnerable to abuse by the medical system because of their memory loss? Ms. Wang in our article referred to the fact that no one understands why ECT works, and that regarding this medical treatment, she uses the term psychiatrists believe. Neither statement can give a person any confidence in the pro-ECT procedure she is touting. She also said, and I paraphrase, that a human being is like a computer and that psychiatrists can reboot the brain. Human beings are not computers. People can't be rebooted, nor do they have wiring that is messed up. This kind of terminology shows the primitive view even trained professionals can have of the ultra-sophisticated human being. Ultra-sophisticated, at least, as compared to chimpanzees. These health professionals are dehumanizing people with this kind of a language. Dehumanizing people is the first step to mistreat people socially and even medically. What you now have with ECT is the same circumstance that existed with the lobotomy. People calling themselves doctors, using treatments they have no scientific evidence to substantiate that are safe and effective, and using public relations, like the media, to push the procedure on the public. Now, psychiatrists believe that this procedure, ECT, works. Proving it works is something very different. And clearly, they have no proof that ECT is a safe and effective procedure. As a matter of fact, with admitted memory loss, psychiatry has proof that ECT is not a safe procedure. Furthermore, Ms. Wang suggests in our article that the anecdotal evidence physicians present is a justification of ECT. Now, doctors laugh at anecdotal evidence. That is, apparently, unless it's their anecdotal evidence that proves they're right. You know, I thought that's what experiments were for, proving if something works or not. Boy, I guess I just don't know my science, do I? Without actual scientific evidence of how ECT works, if it really works, and how much damage does it do, the health professionals have no idea of what the effect will really be on their patient. How can a medical professional give people any treatment if they don't have the scientific evidence to back it up? Why is this allowed in psychiatry? They aren't able to do this in any other branch of medicine. Then came a surprise. I received an email from the Washington Post. This email from Kate Holm, editorial assistant to the Washington Post health section, was asking me if I would give consent to my letter being published in the letter to the editor section of the Washington Post. This was a shock in itself. The editorial department considered my comments on Shirley Wang's article, shock value, to be, quote, very insightful. Imagine that. Psychology was not my formal field of study. Literature was. Then a second shock. An email from Shirley Wang is suddenly staring at me in my inbox. Unbeknownst to me, Kat had sent my email about Shirley's article to Shirley Wang herself. Now, Miss Wang, in her email response to me, did not try to answer any of my concerns. She only reiterated what she had said in her article. After reading Miss Wang's email, I couldn't help but feel if I, a lowly BA in English literature, could stump a degreed professional in the field of psychology, there was much more to be gleaned with some hard digging, which I did. I started to research the field of psychiatry, remembering the horrible feelings I had over the description of lobotomies over the years. Being involved in acting at the time in Los Angeles and having just finished working the last season of HBO series Deadwood as an extra, I was all too aware of the actress Frances Farmer story. Frances Farmer was a talented actress, one of the minor movie stars of her day. The horrible treatment that this talented and beautiful lady received at the hands of psychiatry is documented in several books and movies, off-Broadway plays, many magazine articles, and of course, the well-known film entitled Frances, made in 1982, starring Jessica Lange. Now, what always sticks out in my mind about the Frances Farmer story is that the psychiatric community considered Frances Farmer cured because she was able to hold a job folding clothes in a hotel after treatment. Some cure. On the other hand, maybe some ECT for myself will make it all go away. This is the end of part 1. Next up, part 2. See the link in the description. Thank you for your time.